Cholera is ravaging communities in South Africa. So far this year, more than 30 people have died in the outbreak and hundreds are sickened with a water-borne disease. So how could this happen in Africa's second largest economy? Citizens are outraged by government's failure to address water and sanitation issues over decades. South Africa's President, Cyril Ramaphosa, has conceded his government's failure to deal with the crisis. DW News Africa went to the worst affected area in Gauteng Province, from where Privilege Musvanhiri takes up the story.
Felix used to be a mother of 3 healthy children until the cholera came to Hammanskraal. First, the disease killed her 7-year-old daughter, and then 4 days later, it took her 9-year-old son. Felix still can't comprehend her loss or understand how her children caught the disease.
My suspicion is that they got cholera from the water distributed by trucks. My children never used to wander around in the community. They only played in the yard. I am shocked how they could have contracted the cholera.
Felix is not alone. Other residents feel powerless too.
This water is dirty. We suspect that is the one is causing us cholera.
We can't stay here and watch our people dying because of this mess. Please, we're asking the government to do better.
A temporary field hospital has been set up in Hammanskraal to cater for cholera patients. For more than 2 decades, this community of Hammanskraal, outside Pretoria, South Africa's administrative capital, has struggled with access to clean water. Residents are now used to live side by side with dump sites like this one. Now, cholera has hit the community. Tap water was declared unsafe to drink more than 10 years ago. Now, people are only drinking water distributed by trucks from boreholes. But some fear that the water could be contaminated too. The obvious source is the raw sewer spilling from drains down to streams that supply the main water sources in Hammanskraal. While cholera has been common in other parts of Africa, it was never imagined that cholera would impact South Africa, the most industrialized country on the continent. Here in Hammanskraal, sewage is flowing everywhere. Residents here are angry at the government and are saying that this situation has been neglected for too long. The mayor of the local municipality says it will take a concerted effort to fix the problem.
I and my administration are at the end of a long line of failures and excuses. The central problem is, where do you source the money to upgrade the plant? It's going to run into the billions, which exceeds the capacity of the city of Tshwane alone to undertake.
For people like Felix, that is called comfort. Fixing the problem now won't bring her children back, nor the dozens of people who have already succumbed to the disease.
For more on this, let's bring in Leslie Patrick, Professor of Chemistry at the University of the Western Cape, South Africa. Hello and welcome to the program. Now, you work with water security and water quality under SAGE, that is the Science Advisory Group on Emergencies. Now, SAGE says that the cholera-related deaths were avoidable. So why were they allowed to happen?
Well, in South Africa, we have a really disastrous state of affairs in terms of our sanitation. Most of our wastewater treatment plants are poor or non-functioning. And unfortunately, the type of care that should have been taken has not been taken, and infections like these therefore spread quite easily.
I mean, it's a much bigger problem, isn't it? Because you're also one of a widening collapse of water treatment facilities across South Africa. Tell us really, how bad is the situation?
The situation is worse than Eskom, in my opinion, because we've got really close to 90% of our wastewater treatment facilities that are non-functional or poorly functional, and our potable water treatment systems are in an equivalent type of state of dilapidation and lack of maintenance. There just doesn't seem to be the political will to do something about ensuring that these facilities, which are so essential, are actually cared for and maintained like they should be.
So is that how you're putting the blame on the government, saying there's no political will? Because that's the question I was going to ask, that why has the government failed to address the issue?
Well, in many ways, the reason for it is that budgets that are allocated are not spent properly, or are spent or mismanaged, and that staff are not skilled or are employed in positions for which they're not competent to actually be doing the work. And there's no consequence management. People get away with absolute negligence, and nobody holds them to account. And the different government departments don't hold one another to account. So the Department of Water and Sanitation is not held to account by the Department of Health or by the Department of Environmental Affairs.
So I guess what you're saying is a lot needs to be done on the administrative level of the government. But just to be clear, is it certain that water contamination is the cause of this cholera outbreak?
I doubt if anybody can really track down the cause of the outbreak, and I think that's like trying to conduct a witch hunt, because some unfortunate individual might have caught the disease elsewhere and brought it into South Africa, and then after that the virus or the bacteria spread through our wastewater because there's not adequate sanitation. And a lot of effluent goes straight into rivers from which people drink or which people use. And I think trying to find the actual cause of the outbreak is a bit late now. We know that these bacteria exist, and that if you don't take proper care of your wastewater, this is exactly the sort of thing that does happen.
Right, because we've seen cases outside of Gauteng. Does that mean the disease is spreading?
Yes, there seems to have been quite a few outbreaks. The first one started at Hammanskraal, but since then there have been outbreaks in other centres. And one can only presume that ill people are travelling and spreading the bacteria as they go. Perhaps not everybody is properly ill or is still to get ill while they're travelling. One just doesn't know. It's very well known that humans are the vector for this particular bacteria.
Okay. Thank you very much, Leslie Patrick, Professor of Chemistry at the University of the Western Cape, South Africa. Now, Kenya has been suffering from an even worse cholera outbreak than South Africa, with the blame pinned on poor sanitation, especially in the nation's informal settlements. Now, there are innovative ways of ensuring that clean water gets to the people and dirty sewage doesn't get anywhere near the drinking water supply. DW's Felix Maringa went to look at a project in Naivasha, just outside Nairobi.
This truck is delivering what most people would rather get rid of, human excrement. In a few days, it will be turned into briquettes by a method that ensures that no one would even suspect a whiff of the original products.
We receive fecal sludge via exhauster trucks. The sludge is treated, sun-dried. It's mixed with sawdust, which is also dried. Then after that, it's combined to make briquettes, which is the final product.
Kenyan cities are growing rapidly, but most of the sanitation infrastructure was designed for smaller populations. The growing number of people means waste management systems are groaning under the flow. But human waste can also be a valuable resource.
You're like, oh, that's not just poo. That could be fertilizer. That could be animal feed. That could be macronutrients that the soil needs. That could be fuel. There's so many possibilities. And so I know that we don't want to think or talk about poop because we think it's gross. But we need to remember it is a basic human necessity, just like anything else, that if we deal with it properly, it can be really useful.
This restaurant in Nairobi has been using the briquettes for over 5 years. They say the briquettes give them more burn time and are a cleaner source of fuel. Irene is the manager at 360 Degrees Artisan Pizza in Nairobi.
The briquettes have been very advantageous to us. They're very cost effective, they're environmental friendly, and in terms of quality of production, we've seen our food improve as well as the flavor. The flavor is really good and very less residue.
90% of waste in East Africa is not treated before being dumped into the environment. But with proper waste management and practices such as this, where waste is converted into fuel, then I can get to enjoy my pizza in Nairobi, many kilometers from where the briquettes are made. And there's more. The briquettes are even good news for Kenya's woodlands. More of them means less need to cut down trees for firewood. So from poop to pizzas, what goes in on one end must come out the other.